We've been hearing this morning and indeed this afternoon from Professor Lindsay Graham, who heads up the Infectious Diseases Unit at the Austin Hospital. He began the day going over the latest in scientific research on COVID-19, and in the past hour or so we've been delving into the issue of the training private security guards were provided before being sent into these quarantine hotels. That training has been described as confusing at best, especially on the issue of masks. One of the questions, in fact, as part of this half-hour module was the question of if masks were needed to prevent the transmission of COVID-19 in the community. The correct answer to that question, according to the module, was no, and that it was the only one that could be answered to progress with the training. Of course, while that may have been true for the general community at the time, it wasn't for people who were coming into direct contact with positive COVID-19 cases, such as private security guards. Now, at this stage, it's unclear what further training these guards were provided, but Professor Lindsay Graham has said that this particular training model would only have muddied the waters for them. Take a look.
Asking the question, everyone should be wearing a mask to prevent COVID-19.
Yep.
And if you entered the answer true, could we see the next slide, please? You see that you're told the answer is wrong.
Clearly, this is misleading for healthcare workers or quarantine staff if they thought that they didn't need to wear a mask, when I would consider it crucial if they were in likely contact with a potentially infectious patient.
Tom, the confusion doesn't end there. It also continues with lines of accountability. We've heard this morning from the inquiry that the hotel quarantine program in Victoria was set up in 48 hours, and in doing so there was a rush to appoint different government departments and agencies with different responsibilities, many of which were overlapping, and that there was no clear line of accountability, and the waters were certainly muddied with which department had responsibility for what parts of the program.
There is material suggesting that for some participants in the program, it was not clear who was in overall command of the operation.
Professor Lindsay Graham will return to continue giving evidence shortly. Later on in the day, we'll hear from someone from the Peter Doherty Institute who will be quizzed on this genomic testing, which we know has shown that infection breaches from Victoria's failed hotel quarantine program are to blame for at least a substantial number of Victoria's deadly second wave of cases. The answer everyone is looking for is whether it is perhaps responsible for all of this second wave of cases. Later on in the week, we'll also hear from private security guards and guests from hotel quarantine who'll give a first-hand account of what exactly happened on the ground. And we've also had confirmed for the first time that senior government ministers will be called to give evidence to this inquiry. Tom?